Acne, it can be a little bit stressful as well.
Cord is chatting with a dermatologist right now. Learn a little bit more of how to clear up those unwanted blemishes.
Yes, we've got Dr. Oma Agbai here with us from the UC Davis Dermatology Department. Thank you so much for coming in this morning.
Oh, thank you so much for having me back.
So September, we've had this really hot summer. Kids are outside, they're sweating, the skin is salty, and you've gone to the beach and all the things. And that acne, even if it's already there, it flares up even more because of all the elements.
Right. So acne in teenagers specifically is caused by multiple things. You've got the hormone changes that's causing an increase in the oil production of the skin. And then you've got this keratin buildup. You know, if you're skipping a face wash a couple of times a week, you know, that can build up. And then you have all of this, these hormones and all of these influences. And that can all create an environment for this bacteria called Cutibacterium acnes to grow and proliferate. So I'm seeing a lot of teenagers coming in with acne.
And we've got some pictures here. Okay, so just a heads up, if you're having your breakfast, you might want to pause just for a second. But you mentioned it grows and proliferates, so it's going to spread, and it happens in several different spots. The face, of course, the forehead is also another concentration, and the back.
Right, so it can show up in different parts of the body. Of course, the face is the most common area where we're seeing it because it's such a socially important area. Patients are really embarrassed by how their acne appears, and so it can also occur on the shoulders and on the back. And this is absolutely something that is very, very common, but it is treatable. And there are some over-the-counter options that you can try, and some of those are being shown on the screen here. So really the first step is to make sure you're not doing anything to make your acne worse. Too much scrubbing, too much rubbing, exfoliating
too much scrubbing.
Too much. It can actually worsen acne by irritating the hair follicles. So we want to keep the face washing regimen gentle and simple. So not too many products. And then you have the topicals that you can try that are shown here. Things containing benzoyl peroxide, azelaic acid, adapalene, salicylic acid. Those things can help.
Okay. Now, what about the scarring? Because we were talking about, I asked earlier, is this something that young people, most young people, will grow out of at some point? But unfortunately, the scarring doesn't go away.
Right. So it's really important to go ahead and try to clear up the acne as much as possible when it happens, even though it's true, most teenagers will grow out of it by the time they're in their mid-20s. But the scarring and even the hyperpigmentation, that can last longer, and the scarring can be permanent. So that's the pits in the skin. That is the areas that can be raised or lowered or depressed in the skin. So you want to try to clear those areas up as much as possible to try to prevent the scarring. And there are options to treat hyperpigmentation as well. You know, specifically for my patients with dark skin, they come in more concerned about the dark spots than the acne. And they say, well, just let me treat the dark spots and let's not worry about the acne. I'm not worried about the acne, but you really need to treat both. So something that can be very helpful, aside from definitely wearing your sunscreen because that helps to reduce the hyperpigmentation, is to try a topical containing azelaic acid. And we showed some examples of that as well. It's available over the counter, and that's awesome because it treats the bacteria that causes acne, called Cutibacterium acnes, and it treats hyperpigmentation as well. So you're treating both with one treatment. Stick with it twice a day. You have to give it at least 2 months or so, like 2 to 3 months.
2 to 3 months
for it to start working. And then don't stop using it right away. You got to taper off to the lowest number of applications per week that will keep your skin clear, because a lot of people will have their acne come right back as soon as they stop their treatments.
Which is why you need to go see the dermatologist, because you'll be the ones to keep track of all this and kind of when to use this, when to use that, and when to taper off. Absolutely.
You know, if these treatments are not working, the over-the-counter treatments, talk to your dermatologist. Sometimes the acne is so severe that you really do need systemic treatment if you have nodulocystic acne that's deeper. And so those times, you know, the topicals are not going to work. So you really want to make sure that you are treating the correct type of acne at home and then getting help when you need to with your doctor.
This is huge with teens because it really affects self-esteem greatly. So we want to make sure that you have all the details to contact Dr. Agbai as well as the dermatology department over at UC Davis. All that is on our website, gooddaysacramento.com, under show info and today's date. I mean, look at her skin. It's stunning. Clearly she knows what she's talking about and what she's doing.
Thank you, thank you.
Thank you so much. All right, guys, back over to you.
Thank you.
Yeah, and then when you're old, you get skin tags.
Oh.
So she went,
It happens. Yes, it does definitely happen.
It happens.
Yes. All right, thank you both. We're looking for your weekend pictures. What'd you do over the weekend? We would like to know. And